This week, we will be discussing an overview of global health. The objectives for this week are to compare the roles of major agencies, responsibilities for national and world health issues and policy, evaluate major global health threats identified by the CDC and WHO, and to analyze the extent to which these world health agencies can intervene in health crises in various countries. Key terms and concepts for this week include global health, which refers to health problems such as infectious diseases and other communicable diseases, as well as the overall health among different countries and nations in the world. Health policies, which is authoritative decisions focusing on health that are made in the legislative, executive, or judicial branches of government and can vary from different countries. There are several national and global health organizations. Examples of those include the World Health Organization, the Centers for Disease Control and Prevention, also known as the CDC, the U.S. Agency for International Development, Organization for Economic Cooperation and Development, OECD, and other examples such as UNICEF, which focuses on children. The work of the World Health Organization, or the WHO, is facilitated when consensus is reached among countries on global priorities in the health center arena. Positive aspects include awareness and mobilization of resources among all nations, and negative aspects include global warming, the spread of pollution, financial crises, international crime, and the spread of other diseases such as HIV and AIDS. Global health patterns number 1. People are healthier and wealthier, and so they're living longer today than they were 30 years ago. This creates more challenges among health-related concerns, especially amongst different nations globally. If children were still dying at the rate of how they were in 1978, there would be 16.2 million deaths globally in 2006. However, children are living longer. The once revolutionary notion of essential drugs has become commonplace, and there have been significant improvements in access to water, sanitation, and prenatal care. Global health patterns 2 predictions. Increasing health issues related to the use of tobacco. Males in Europe will have deteriorating health. Mental health diseases will be responsible for 1% of deaths. Communicable diseases, maternal, perinatal, and nutritional problems continue in developing countries. And depression and heart disease cause premature death and disability. Predictions related to global health patterns. Non-communicable disease deaths will increase by 77% related to population aging and decreasing birth rates. Deaths from accidents and violence may compete with deaths from illness. The predicted leading causes of death globally are ischemic heart disease, unipolar major depression, traffic accidents, cerebrovascular disease and COPD, and tuberculosis or lower respiratory infections. Population growth issues. The world population has about 7 billion people. 20 versus 17, with an estimated give or take 5 years. From December of 2012, from back to 2009. The expected growth rate is 76 million per year. This is the amount of people that will continue to increase in the population. To get a closer look at the most up-to-date information regarding the population, please check the census.gov website listed below. Further population growth issues are family planning has decreased. The average family size, instead of having 6 children, now is down to 3. Countries with decreasing birth rates are expected to have an increased aging population due to advances in healthcare. Developing countries will have 96% of the world population, and the population in Europe and Japan is expected to decrease. The U.S. population is expected to increase, and one of the reasons is because of the high amount of immigration occurring in the United States. The rate at which HIV and AIDS is expected to grow. Major global health threats, number one, or one of them, is infectious diseases such as HIV, the Ebola virus, avian flu, the swine flu, tuberculosis, and cholera. Another is antibiotic-resistant bacteria such as MRSA, or viruses not impacted by antibiotics, or other means such as antifungals. Unintentional injuries such as in the automobile industry or the workplace industry. Violence, including domestic, physical, mental health issues, and the use of tobacco and urban air pollution. There are different ways to measure the indicators of global health, and some of them are listed below. They include life expectancy, the healthy life expectancy, or HLE, mortality, morbidity, and disability, along with safe birth. Below is a website where you can find more up-to-date information on the number of safe births occurring annually. Further measures and indicators of global health include pregnancy and birth-related issues. Remember that the newborn phase is the first 30 days of life, and that infancy is the first year of life. So you want to look at statistical rates when they are discussing newborns versus infancy and death rates that occur in those populations. In underdeveloped countries, pregnancy and birthing sometimes has issues with safety. And again, you can visit the website below to find out more information on safe birthing practices. Theoretical solution plans to some of these issues. The Millennium has summit goals that are to be accomplished in 2015. Below are some of the goals, which include to improve areas of peace, security, and disarmament, to eradicate poverty, to protect the environment, further issues and progress towards human rights, democracy and good governance, protecting vulnerable populations, to assist with Africa's special needs, and to strengthen the United Nations. For more information regarding an overview of global health, please refer to the textbook of Holtz, along with information from the World Health Organization website and the Safe Birthing website.